Hi, Wayne Campbell, creator of the Stretch Therapy Method. Today's video, we're going to focus on the muscles that surround the acetabulum and the head of the femur, which is the leg bone that goes into the acetabulum in the hip socket, basically. So these will be the muscles that surround that. So you've got the TFL, tensor fasciae lata, the sartorius muscle. You got the glute also that runs into that leg, and the adductor muscles. So let's go ahead and get started. Come to sitting. Let's bring the right heel in to the hip, slide your left foot out to the left in a half straddle. Now, you're going to internal rotation of the left thigh, lift the left hip up, flex the left foot, and internal rotation, push that left hip forward. So you lock out the left knee, your left heel is directly out to the side, not slightly forward, but straight out to the side, hip, knee, and left heel, straight out to the side. Your hands slightly off center to the right, front right corner. Keep your upper body lifted and forward a little bit. Now, from here, keep the foot flexed, keep the leg locked, knee locked, leg straight, and bring the left hip back down. Keep your upper body up and forward. Again, lift your left hip up and internal rotation, push the left hip forward. And again, bring your left hip back down, and again, lift it up and forward. Keep the left foot flexed, push the left hip forward. Stretch up out of the lower back, bring your left hip back down. And we're gonna slow this down. So as you bring the left hip up and forward, stay there and let the muscles, surrounding muscles, acclimate to that. So where I'm feeling this is right up into that side of that left hip right there. A little funny bone sort of sensation right there. And stay lifted. Breathe into that. Keep the knee locked, foot flexed. You tend to want to relax. Flex the foot. Now, bring the hip down. Rotate the left hip down, left toes up. And again, lift left hip up and push it forward. And bring the left hip back down. It's going to increase your hip mobility, decrease chronic pain, tightness that you have in that hip, increase your hip joint mobility. Bring the left hip forward again. Now from there, you bring your hands on the outside of your right knee, push down and lift up. Push the left hip more forward. Stretch up out of the lower back. Press the shoulders, palms down, and stay lifted. Breathe, inhale, exhale. Slow inhale, slow exhale. Lengthen up out of the lower back. Keep pushing that left hip forward. And the muscles will eventually lengthen, let go, and relax. Just breathe into this through the nose. Inhale, exhale. You can already feel how this is going to bring relief, mobility increase, and flexibility increase in that area. The inner leg adductor gets stretched. The hip flexor, actually the sartorius, the TFL, and then where that glute comes into the hip attachment. All right, let's bring the left hip back down. Slowly rotate out of that. Bring your left foot forward. Slide your right foot forward. Bring your left heel into the hip. Slide your right foot out into a half straddle. You're going to flex the right toes, point the left toes, left foot. And then slide the right heel back so that the right hip, right knee, right heel straight out to the side. So if I turn this way, I'll show you what this looks like. Bring the right foot out, half straddle, and then lift the right hip up, slide the right foot back so that the right hip, right knee, right heel is straight out to the side. Lifting up and bring your body slightly forward. All right, so we'll do that again. From here, bring your hands off center forward. Just off center, front edge of the mat, left edge of the mat. So lift up, press your right hip forward, lock out the right knee, flex the toes forward and flex them in. Stay there. Now we're going to rotate externally, bring the right hip down, the right toes, right knee, right hip bone pointing up to the ceiling. And again, lifting your right hip. Internal rotation, push your right hip forward, stretching up out of the lower back, lengthening up out of the lower back. Keep the right knee locked. And again, bring the right hip back down. Let's do that several times. Just working through the hip joint mobility, lengthening through the muscles, and bring the right hip back down. So just keep in mind what's happening here also is that joint mobility is directly related to muscle flexibility. So as you're lengthening, increasing the flexibility in the muscle, the joint mobility will increase. Internal rotation and then external rotation. We're just breaking up that tightness in the tendons, the muscles, the fascia, and then slowly moving through that joint, the right hip joint, where the femur, the head of the leg bone, which is called the femur, fits into the acetabulum, which is part of the hip. It's a socket of the hip for the leg bone to fit into. So we're just creating more movement, lengthening through the hip joint by increasing the flexibility. Just keep moving forward and back several times. Keep the right glute down and bring the right hip up and forward several times. And then once we bring the hip up again, we'll bring the right hand, left hand outside your left knee, left leg, lift up, stretch up. Keep pressing the right hip forward. Keep the right knee locked. Flex the right toes, the right foot flexed. Push down and lift up. Push down with the hands. Press down from the shoulders and lengthen up out of the lower back. Breathe. Lock out that right knee. Keep the right heel, right knee, right hip straight out to the side. Stretching inner leg, adductor muscles of the right, front of the right hip, side of the right hip. And just slow inhale, exhale. So when you do come out of this, you're going to want to probably lay on your back and just notice. Let the body, the hip, and the lower back come back to center. Balance out and relax, because this is pretty intense. So we'll give it a couple more inhale, exhales. One more inhale. Exhale. From there, slowly lower the right hip, slide the right foot forward, and let's go into our backs. Allow the nervous system to calm down, allow the bone joints to settle into the floor, realign, readjust, allow the muscles to relax. Soften through your face, relax your shoulders to the mat. Inhale, exhale. So that's it for today's video. Thank you for viewing the video and doing the stretches along with me here. Remember to go to our Stretch Yoga Therapy page and hit the like and subscribe.